In the district, families and medical centers are sounding the alarm, warning about the devastating impacts proposed cuts to Medicaid could have. Congress is currently considering major changes to the federal program as it finalizes the 2025 budget. DC News Now's Marielle Carbone is live outside Children's National Hospital tonight. And Marielle, this could be particularly hard for DC.
Yeah, Tosin, it could be. We are yet again talking about another potential devastating cut here in D.C. We know that nearly 300,000 people rely on Medicaid, 95,000 of them children and infants. Now, here at Children's National, leadership says that this is the biggest threat to children's health care they've ever seen.
As a mother, for someone to say, hey, you may not be able to afford your child's medication is really heartbreaking.
But that could be the reality for Ward 8 mother LaJoy Johnson Law.
We would have to make some really tough decisions. Am I paying to put a roof over our head, or am I paying for medication?
Johnson Law's 13-year-old daughter, Abria, has special medical needs and relies on Medicaid, a joint federal-state program providing health coverage for low-income residents, those with disabilities, and more.
So think about like your neurologist. Think about pulmonary.
Currently, Congress is considering major cuts to the program nationwide, including scaling back the federal match in D.C. from 70% to 50%. And that would result in a total $2.1 billion loss.
And lead to hospital closures, longer wait times.
D.C.'s funding percentage was set back in 1997 by a Republican-led Congress. It's higher than most, but not all states, because D.C. is restricted by law on how it can raise revenue for the program.
It's not a red state, blue state issue. This is a issue of, do we want to have quality health care in the nation's capital or not?
The impacts would be immediate and devastating.
Children's National Hospital would be hit particularly hard.
It would cost Children's National an estimated hundreds of millions of dollars.
Impacting families like Johnson Law's.
It literally is a lifeline.
And Children's National says that 70% of the cases that come through the ER are funded through Medicaid. And they also say that the biggest department that will be impacted is the neonatal unit. That is the one that cares for infant children. Reporting live in Northwest, I'm Marielle Carbone, DC News Now.